It's winter time, and now your newborn is with you for the first time facing this winter. As concerned mothers of a newborn, you will be wondering that there's a change in the weather, there's a change in the level of humidity in the air. Your child is going through this smog, fog kind of feeling which is around, and the sudden dip in temperature. Changes that your newborn will go through and face with these changes of weather is what we are going to discuss today. I'm Dr. Nihar Parekh, and with me is Dr. Pankaj Parekh.
Hi.
And we are going to throw some light on this issue today.
The skin of the newborn is usually dry. Many of us, you will notice, within first few days after the birth, the baby's skin peels off, particularly from the hands, from the extremities, from the feet. They lose luster, they look very dry. This is adversely affected by the drop in temperature in winter and little additional pollution in the air. Traditionally, we have been moisturizing skin with various types of oils, which can be either a coconut oil or it can be even almond oil. But we have seen that all these oils cause a lot of allergy and a lot of skin problem. The best way to keep the skin of a newborn very healthy and lustrous is to use a moisturizing solutions which are customized and made specially for the newborn skin. If you do the moisturizing application twice a day, once in the morning, once in the late evening, the newborn skin will be maintained beautifully. In addition to the skin, in winter, the children have a lot of problem of cough and cold. Dr. Nihar, would you like to enlighten the people for the problem?
Yeah. So when the baby comes up in the world, the new world, every mother is very, very keen that irrespective of the changes outside, the weather, the temperature, I want to do best and prevent my child, my newborn from falling sick again and again. How can I manage? A word of caution, your child is going to breathe the same air that we breathe. It's going to experience the same amount of pollution, smog, and the heaviness in the winter weather that we go through. So this is going to lead to simple coughs, colds, sometimes with fevers, feeding difficulties in your newborn. This happens because of three reasons. Number one, the dip in temperature. Number two, the heaviness in the air. And number three, the pollution around, which collects and makes the situation worse. But the most important is people around the house having persistent cough, cold, sore throats in this weather, which give newborn its problems. Now, when you're with your newborn, it may start coughing with the change in weather, with sick people around. Keep a watch. Keep a watch on whether the cough is just a regular cough or the cough is bothering its day-to-day activities like sleep, feed. Is it causing just the nose block or causing breathlessness? If there is breathlessness, high spiking fever, very irritable newborn or very lethargic newborn, please go to your doctor immediately. It doesn't take time for a simple cough and cold like this to spread into a pneumonia very quickly. And with your newborn, which cannot express itself as clearly besides just excessive crying, it may be very difficult for you to do the next thing unless until you take it to the right doctor. Sir, can you help us out just with certain red flags the parent should keep in mind while dealing with these coughs and colds in their newborn?
The cough and cold occurring in a winter season in a newborn baby are never a problem of lack of immunity. It is usually allergy to the pollution and dip in temperature, or more commonly viral infection, as Dr. Nihar said, due to family members coughing and having cold, spreading and giving virus to the newborn baby. It takes time to get rid of this. It is not possible that particular medicine will make the newborn baby all right in a day or two. It might take a little longer time. The blocked nose is more troubling problem because the children can't sleep well, can't take feedings well. Simple saline drops very frequently put in on both the side of the nose, particularly before feeding, will make the baby very comfortable. Remember, even if you make the newborn baby all right, this cough and cold can keep on happening again. Do not get scared, do not get panic, and we on our side try and never give antibiotics to these newborn children unless the red flags, what Dr. Nihar has described, very high fever, listlessness, lethargy, irritability, breathlessness. In such situation, after proper investigations, we need to give sometimes antibiotic to these children.
Thank you very much, sir. So keep these red flags in mind. Take care of your newborn and enjoy the winter.
Tune into our channel, Child and You, for tips and guidance to raise a healthy child.
Live now, live healthy, only with Sushruta. For any queries, you can write into us on or WhatsApp us on